I noted in standing that her right navicular bone is more prominent. So I evaluated mobility of the navicular and of the cuneiforms, cuboid. And the motion was same as the other side, and it was normal. So then I tested the proximal tibia, and this tibia does not internally rotate, okay? So if I stabilize the foot, and which I actually am doing, and I tried to rotate it medial, there's no give, okay? Now I'm gonna rotate it externally. I take it to the end of the range where motion stops, and now I spring it, and I don't think you can see it. If you look at my ring, you'll see there's little micro motion there. And so I'm gonna restore that play. I'm gonna put the phone down, it'll keep running, and I will then film her response to treatment. So bear with me for about 10 seconds. Alrighty. So now I can rotate it more freely to an endpoint. And then if you look at my ring, you can see it does have that normal rotational joint play. Okay. Can you step down and walk up and down the hall? And then come back and just stand right there. It looks symmetrical now. Tell me how you feel when you're walking.
It feels very, very good. It felt less stiff, where before it did feel stiff, and I don't know if that's because when I broke my fibula, it never regained its fluidity, I guess. And I am always moving my ankles like this to try to get some movement in there.
Okay. Well, I think that movement will stay because every time you walk, it's going to automatically find that range of motion. So it's once and done. You don't have to see me 12 times for me to do the same thing to you.
Okay.
Once is enough.
Okay.
If it's done properly, once is enough. And we did it properly. My other comment on your findings is that you felt really great, right?
Yes.
What did you tell me?
That from yesterday's session, I was not ever able to lie on my right side because the pain was excruciating just to lay on my right side, just in my thigh. Last night I slept really well. I even purposely laid on this right side to see if I could mimic this pain.
Nice.
It was not there. The only issue this morning that I had was I did have a little bit of issue at the top of my pelvis. That it wasn't excruciating, but it was a little bit of a chronic pain. And then I have about a 35-minute drive over here. I did have severe pain in my ischial tuberosity bone for a very long time. I mean, a decade or more. Or it felt like it was just pushing into whatever I sat on.
Okay.
I only felt that I had to sit 2 hours for a Zoom call last night. I did not have any problems at all. No problem sitting down in a hard chair at all for 2 hours. But on my drive over here this morning, I felt just a little twinge about halfway here. So about 20 minutes in, I just felt a little bit of, I don't even want to call it a pain, but just a little bit of uncomfort.
Okay. And were you aware this morning that the ischial tuberosities were not symmetrical?
No, I didn't feel that at all. I felt very symmetrical.
Very good.
Actually.
Okay, great. So today we did find another pattern we didn't find previously, and we call it an anterior ilium, but the whole pelvis can move asymmetrically and become fixated in a pattern where it loses motion in one triplane direction and has greater motion in another. And you had that, and we treated it very successfully. Actually, you self-treated it. And after that, you sat. And how did you feel after restoring?
I felt very good. I sat up and down, stood up and down, sat.
And I
moved
mean,
my pelvis
yeah,
back and
for
forth.
today. Yeah.
Yes, for today.
Yep.
Moved my pelvis
Yep.
back and forth, back and forth. That issue is gone now.
Good.
I don't feel that.
Good. Do you know how to manage it yourself?
Yes, I do.
Bingo. Once and done. Thank you. I'll stop filming now.